Dr. Beabout here. Let's do our medical word of the day. And today I want to do an injury. And that injury is a mallet finger. Now, a mallet finger is a rupture of the tendon that allows you to straighten your finger out. And the rupture occurs right at this distal joint. All right. And what happens, and usually it happens when you do something like catch a football wrong or something like that. You jam your finger head on and it causes a rupture of this tendon because it causes a sudden snapping down of this joint and it'll pop that tendon right there. And it can either break the tendon or it can pull it off the bone and pull a chunk of bone with it. Either way, you end up like this and you can't straighten your finger. Now, a mallet finger can be troublesome to fix. Obviously, you can't cast it. They do make a splint that you can put on, and that is shown here. But the problem with fixing it is nobody does what they're really supposed to do. And you have to wear this splint with your finger in this position for weeks to months. Weeks to months, at least 6 to 8 weeks, maybe longer. And the trick here is if you take that splint off and you let that finger drop, you got to start all over. So obviously you have to clean it. So when you do, what we recommend is you take the finger off and slide it off, leaving your finger on a countertop so it'll hold straight and it won't bend. And you got to leave your finger there all the while you're cleaning the splint, and then you put it back on without letting your finger bend. And you got to do this for 6 to 8 weeks. Otherwise, you either permanently have a mallet finger or you end up with surgery and they go in and they pin it. So those are your options. It's not as horrible an injury as you could get orthopedic wise, but it is an aggravation. So if you hit something wrong, you snap your finger down and it will not straighten out, that's a mallet finger.